could.
How'd you do that?
Well, I apologized for bothering him, explained why I was calling, and asked him if there was any information he could give me so I wouldn't have to keep calling.
And?
Well, he finally told me that his mother had died the week before.
Well, why didn't he just tell you that in the first place?
It could be because he was still grieving or in shock over the loss. Some people are afraid of scam artists who prey on widows or widowers. That's why you have to probe sensitively and carefully to find out what happened. I said how sorry I was and made a note of it in the files. It was too soon to ask him, but I noted that he should be contacted at a later date about a next of kin interview.
Another special situation is a chronically ill respondent. Illnesses such as cancer, heart disease, or severe arthritis not only can cause physical discomfort, but the illness or medications taken for the illness can affect alertness, physical stamina, and emotions. This means that you must be alert and sensitive to how the respondent is feeling and be ready to reschedule if necessary. Although interviewing a chronically ill person can be challenging, the data from such interviews can be extremely important to the generalizability of the study findings. Interviewing the chronically ill often requires dealing with another type of gatekeeper, the institutional gatekeeper. Institutions are often very concerned about the privacy and safety of residents, which means you have to contact appropriate administrators to get permission to interview. In the case we're about to see, Catherine obtained permission from the Director of Nursing after carefully explaining the study and the importance of interviewing people in nursing homes.
Dad? This is Catherine Wilson and John Rose, the ones I told you about from the research center.
Hello, Mr. Mann. It's a pleasure to meet you.
Hi.
They're going to ask you some questions, and I'm going to sit here with you, and I want you to tell me the minute you don't feel well enough to continue, okay?
I'm okay.
Okay, Mr. Mann, you already signed the consent form, so now I'm going to read you some questions. Each question will be followed by a list of possible answers. And I want you to choose the best one from the list. Are you following me so far? Okay. The first question is, would you say your health in general is excellent, very good, good, fair, or poor?
What do you think?
Mr. Mann, I'm very sorry. I know that some of the questions may seem inappropriate, but I'm required to ask each one in the same way to everyone in the study.
All right, all right. Poor, then.
Thank you. Now, would you say that in the past month you engaged in any physical activity or regular exercise less than 1 year ago, or a year ago or more?
Dad, did you hear the question?
Yes, I heard the question. I don't know. How do you expect me to remember these things?
I'm sorry. I know that some of these questions can be difficult.
How much longer is this going to be? Because I've got to talk to somebody here about something.
It will take about 10 more minutes.
Who do you have to talk to, Dad?
I just have to talk to somebody here about something. I have to do it this afternoon.
Would you like to reschedule the rest of the interview?
Yes.
That's fine, Mr. Mann. We'll stop now. I'll talk to your daughter about a time for rescheduling and then check it out with you. Thank you so much for your help. I hope you'll feel better.
Thank you.
He's not feeling good, but he didn't want to admit it. I think the medication he's taking is making it hard for him to concentrate.
Of course, I understand. Is there a day of the week or a time of day that you think would be best to complete the interview?
I don't know. I think maybe he's too sick to do this.
Because he's sick, his participation is critical to adequately represent a random sample. It's very important that we include someone like your father in order for the study to benefit others like him.
Okay. How about next Friday afternoon? Maybe by then he'll be feeling better.
Next Friday would be fine. Say around 2 p.m.?
Yeah, 2 o'clock's fine. I'll talk to my father.
Thank you very much.
Thanks. That was difficult. He was so irritable.
Well, you need to remember that he wasn't feeling well. No matter how irritable someone gets, it's really important to stay calm and patient. A lot of times it's because they're ill or on medication. Mr. Mann was losing his concentration, and I think he was in some pain.
Why didn't you just say that?
Well, he did, indirectly, by saying he had to meet with someone.
He did seem pretty uncomfortable. Wasn't it awkward asking about exercising? It was pretty obvious he could hardly move.
Well, you couldn't be sure that Mr. Mann hadn't exercised lately. He might have been able to walk earlier in the week, or even the day before. You know, being sick doesn't necessarily mean being physically impaired. A lot of sick people are able to walk using canes or a walker. You know, you can never prejudge someone's capabilities.
Irritability and problems with concentration can be common among the chronically ill. Catherine did well to ask Mr. Mann if he wanted to reschedule the interview. When you encounter a special situation such as a chronic illness, remember to be sensitive to signs that the respondent is tired or in discomfort. Reschedule an interview if necessary, and probe gently to determine the status of a respondent if you have been repeatedly unsuccessful in making contact. Aside from chronic illnesses, older adults may suffer from various physical, sensory, or cognitive impairments. These can cause problems with seeing, hearing, speaking, or simple physical acts we take for granted, such as holding a telephone or sitting for a long time. Some impairments can be accommodated with the help of technology, as John is about to find out.
It's time for the call back to Rose Travis. Why don't you do it?
Okay.
Hello?
Hello, Mrs. Travis.
Yes?
Hi, this is John Rose. I'm calling from the United Research Center.
Who?
John Rose. Catherine Wilson called you this morning about a study we're doing on the healthcare needs of older people.
Health care needs?
I'm sorry. I have trouble speaking clearly over the telephone sometimes. I said we're conducting a study on the healthcare needs of older people.
Oh, I see. What was your name?
John Rose. Mrs. Travis, could you hold on a second?
Here, try this. And speak slowly and clearly.
Mrs. Travis, I'm sorry about that. We're doing a study on the healthcare needs of older people. I'd like to ask you some questions and make an appointment for Catherine Wilson to come visit you in your home and do a longer interview. Of course, all your answers will be completely confidential.
I suppose that would be all right.
Great. First, what is your date of birth? Do you currently use a walker or a cane during any of your daily activities?
No.
Okay. That's all I need to ask you for now. I would like to make an appointment for Catherine Wilson to come over to your home and ask you some other questions.
Yes, dear.
Great. Could we schedule that for this Wednesday, say 10 in the morning?
Okay.
Great. Thank you very much. Goodbye.
Good job. You were able to complete the preliminary interview and set up a home visit.
I guess I'm getting the hang of this. Boy, she must have been wearing a hearing